Hi, my name is Shay Reitler, and I will be showing the skill of putting on an IV piggyback medication. So before I get started, I'm going to wash my hands. I'm going to go to the med room, and I'm going to check my MAR. So my order is to administer claforin 560 milligrams IV piggyback every 8 hours. My reconstituted bottle of claforin is 500 milligrams per milliliter. Place in 50 milliliters, 0.9 normal saline. Infuse over 45 minutes. Give 4 doses. So when you go into your drug guide, and even before this, I'm going to make sure I have my right patient. I'm looking for the right medication, right dose, right route, right time. I'm just making sure I'm pulling the right med out. I'm doing those 3 checks before I pull the med out, when I pull the med out, and again at the bedside. But we are going to look into claforin because our patient does have a sensitivity to penicillin. So claforin is indicated for those with respiratory infections, and our patient does have bronchial pneumonia. But if you look under contraindications, it has a serious hypersensitivity to penicillins. So at this point, I'm not going to give this antibiotic. I'm going to call my doctor, let him know what I found out, and then get a new order for a different medication. But for pretend, I'm going to go off the dosing and everything for this med, even though we have it changed since he would be sensitive to this one. So for this medication, you want to make sure you're looking at, is it appropriate for my patient's age? Because the difference in geriatrics to adults to pediatrics can always vary. And you also want to go by weight too. So I calculated my patient's weight is 158 pounds, but it's also 71.8 kilograms. And in my research on this med, if you're over 50 kilograms, you can't have more than 12 grams of this medication a day. So that's where we're going to do our med math. And also for IV in adults and children greater than 12 years old, 1 gram every 12 hours. And when you're calculating our dose, so we're giving 560 milligrams every 8 hours. He's only getting 0.56 grams every 8. So he is under the dose. His age is okay, and his weight was okay for this dosage. I'm gonna close this. So after you got that all figured out and you get your med straightened out, if it is incorrect, you want to make sure you let your physician know. I'm just going to do my check after I pull my medication out, make sure I got the right med, make sure the solution looks okay, check my expiration date, which is October 1st, 2020, and everything looks okay. So now I'm going to go to my patient's room. Oh, and I gathered all my supplies and everything. You want to make sure you gather the appropriate size needle to take out your medication too. So when I calculated how many milliliters I'm going to pull out from this, I got 1.1. So I chose a 3 milliliter syringe so that I can more accurately pull that medication out. So I gathered all my supplies. I'm heading to my patient's room. I'm going to wash my hands, introduce myself, check the patient's name and date of birth. I'm going to double check those allergies. Make sure I got my right medicine, it's the right time, got the right dose, right route. And before I do anything, I'm just going to explain to my patient what this medication is for and explain that it is for his bronchial pneumonia, and make sure he understands that and give him some education on side effects, stuff like that. So when I get started, I'm going to start so we'll let this one hang here. So he already has his current infusion going of his normal saline. So I am going to start by getting this one ready. Move them over. Okay, and then just again at the bedside, making sure I have the right antibiotic And then I'm putting it in 50 milliliters of sodium chloride, and I'm checking this too. My expiration date is okay, nothing in this. So first I'm going to open my tubing. Got my tubing. Get this all out. Oops. Oh, and make sure you have the correct tubing too, because there is, this is especially for piggyback, so it comes with your little hanger too, and it's shorter than the primary line. So first thing I want to do is clamp this line, and oh, it's right here. And I'm going to label my line as well. With date, time, and initials. Okay. I'll put this aside for a second, and I'm gonna open this one. I might need scissors. And again, just check and make sure you got that sodium chloride. 50 milliliters. And I'm going to label this one. Patient name. Date. Time. Initials. And then we're also going to make sure we put what is in here. So 560 milligrams, and then it's not claflorine because we changed, but you would write the name of the med, and then the time too. So I got this and I got my line, so now I'm gonna get my med ready. I'm gonna wipe this off. And just double check with that MAR, make sure I've got the right med, and checking your vial too. If it is single use, you don't have to worry about labeling it or anything, but if it was a multi-dose, making sure time, date, initials, and then the date from now that it is good by. I'm gonna open, and I got my 3 milliliter syringe, and I have my med map here. I don't know if you can see that or not, but I got 1.1 milliliters is what we're gonna draw up. So I'm going to pull back 1.1, and this syringe is perfect size because it has each line for in between like 1 and 2. I'm going to pull my cap off. I'm going to inject the air in, and then just pull back that 1.1. Okay, checking for air bubbles. I'm going to go ahead and just scoop and recap. Put this to the side. This one. Okay, now we can open the port to the piggyback. Oh, whoops, wrong one. Well, I'll put this on. Maintaining sterility with this spike here. Make sure you puncture the inside there. Okay, once I got this, I can inject into this port here. And then I'm just going to scoop and put in my sharps. So now that you got your medication in there, just make sure you're turning it. You don't want to shake it vigorously, or just turn it back and forth a few times. Make sure it gets all mixed up. Okay, and then mine is already pretty low. Let's see. So you would hang your piggyback on top, and then your larger bag would go below. And I apologize, mine is really low. Yeah, it's gonna fall down. Okay. I'm just gonna prime my tubing here. Get it all the way to the bottom. Okay. Okay, and I'm gonna wash my hands. Put on some new gloves. And while you're here too, make sure you're just assessing that IV site, making sure your fluids are running. And we're going to adjust the primary roller clamp. And we'll use this first port here. Making sure you clean that off. And then we can hook up our piggyback line. And then adjust your piggyback to where it needs to be. And I forgot, I'm gonna go back. When I hooked up my line, I should have filled this halfway. I apologize, but I knew I should have done that. So now I'm gonna adjust it, and will be infusing into my patient. And that is over 45 minutes. And it's, you're giving 4 doses. So once every 8 hours. Take off my gloves, wash my hands. I'm gonna make sure that lines are running. And then again, just check that IV site. And then when it's finished, you would just roller clamp this one shut. You can unhook. And then when you're tossing this, making sure no patient information or anything is on there. And then you can restart or readjust the dosing on your primary line, and making sure you adjust your clamp too, so it continues. And that's it.